Hello there, welcome to Shine Tech's YouTube channel. In this video, we're going to look at edema pathology. So, edema is simply an accumulation of interstitial fluid in tissues. Okay, it's simply accumulation of interstitial fluid within tissues. So, this accumulation of interstitial fluid results from movement of fluids from the vasculature into the interstitial spaces, that is the spaces which surrounds the cells. So from the blood vessels, the fluids are accumulating in the interstitial spaces. So this fluid can be a transudate or an exudate. A transudate is a fluid which is poor in proteins, and an exudate is a fluid which is rich in proteins. Now let's look at this diagram to understand what a transudate and an exudate is. We have said this edema can be in form of a transudate or an exudate. But what is a transudate and what is an exudate? So a transudate is a fluid which is poor in proteins. Okay, there is low protein contents in a transudate. So on this diagram here, you can see we have a normal blood vessel there. Okay, so in a normal blood vessel, we have two forces, or let's say pressures, which maintain the fluids inside the blood vessel. So we have what we call hydrostatic pressure and choroid osmotic pressure. So hydrostatic pressure pushes the fluids out of the blood vessel, and then oncotic pressure, or let's say choroid osmotic pressure, will pull back the fluid which was lost back into the blood vessel. So these pressures maintain the fluid in the blood vessel. But for an exudate to occur, we have the plasma proteins being lost in the interstitial fluid due to endothelial permeability. So the increased endothelial permeability can lead to loss of proteins into the interstitial, followed by water, making what we call an exudate in the interstitium. The accumulation of that fluid there is what we call edema. Then a transudate, we only have fluids leaking out, but the proteins remain in the blood vessel. Okay. Now, apart from edema, we have other terms such as effusion. So effusion is accumulation or collection of extravascular fluid in the body cavities. So we have body cavities such as the pleural cavity, the pleural cavity which surrounds the lungs. Then we have the pericardial cavity which surrounds the heart. Then we have the peritoneum, okay, in the abdomen. So accumulation of fluids in those body cavities is called effusion. So if it is in the pleura, we say the pleural effusion. If it's in the pericardium, we say pericardial effusion. If it is in the peritoneum, we say ascites. Apart from effusions, we have what we call anasaka. So anasaka is simply a severe generalized edema, and this edema is marked by swelling of the subcutaneous tissue and accumulation of fluid in body cavities. So we have effusions accompanied by subcutaneous swelling of the subcutaneous tissue. And remember, this should be generalized. So the combination of body cavity accumulation and swelling of the subcutaneous tissue is called anasaka. Okay, so anasaka is simply generalized edema which is marked with swelling of the subcutaneous tissue and accumulation of fluid in body cavities. Okay, now let's understand the mechanism of edema. How does edema come about? So to understand that, I'm going to use this diagram here. Okay, so in this diagram we have a blood vessel. Okay, so this is blood vessel, and we have the arterial end. Okay, remember the arteries brings blood to the tissues, and then the veins drains the blood. Okay, so this is the lymphatic system which drains the excess interstitial fluids. So when blood comes from the heart via the arteries to the tissues, we have increased hydrostatic pressure. So that increased hydrostatic pressure will start pushing water outside in the interstitium here. Okay, and then what happens? We are going to have a concentrated blood at the venous end due to the proteins. So the proteins are never filtered. Okay, due to that hydrostatic pressure, we have fluids leaving the blood vessel, but as blood flows in the to the venous end, we have increased plasma choroid pressure. So that increased plasma choroid pressure, osmotic pressure, will lead to draining the fluid back into the blood vessel. Okay, the hydrostatic pressure and the plasma choroid pressure are almost the same. So what will happen is that the plasma choroid osmotic pressure will pull back the fluids which were lost by hydrostatic pressure. Okay, and then the smallest volume of fluid which is left in the interstitium is drained by the lymphatic system. So the lymphatic vessels will drain the excess fluid, and then it will take that fluid back into the blood circulation via what we call the thoracic duct. So any impairment in these two forces, the hydrostatic pressure and the plasma choroid pressure, will lead to edema. Okay, so if we have increased hydrostatic pressure, that is, the hydrostatic pressure is increased, so we're going to have a lot of fluids leaking out of the blood vessel. So here in the interstitium, we're going to have increased accumulation of the fluid that will lead to edema. And if we have plasma choroid osmotic pressure which is reduced, then we won't have that pressure which will drain that interstitial fluid back into the blood vessel. That will also lead to edema. Okay, so now the lymphatic system drains the excess interstitial fluid back into the blood. That is, we have these lymph vessels which are green in color. So they collect that excess fluid via the thoracic duct, draining it back into the veins at the subclavian vein. Okay, so at the subclavian vein there, the thoracic duct drains the excessive interstitial fluid into the blood. So if we have any impairment in the lymphatic system, that will also lead to accumulation of fluid here in the interstitium, leading to edema. Okay, so that is how edema occurs. But now, what are the causes of edema? So edema can be caused, as we have seen, by what we call anything that can increase the hydrostatic pressure. Okay, so what increases hydrostatic pressure are divided into two. It can be anything that impairs venous return or arteriolar dilation. So impaired venous return can be things like congestive heart failure. Okay, so congestive heart failure impairs venous return, and then constrictive pericarditis as well will impair venous return, leading to edema. And remember, in congestive heart failure, we are going to have generalized edema. Then we can have constrictive pericarditis, where we have the impaired contraction and relaxation of the heart due to the disorders of the pericardium, the outer covering of the heart. Yeah, okay, so it is constrictive, so it is preventing the heart from contracting and relaxing properly. So the heart is failing to contract and push the blood out of the chambers. So that will lead to increased venous pressure. Increase in venous pressure will lead to increased hydrostatic pressure, thereby leading to what we call edema. Okay, so we have ascites, okay, that is observed in reverse cirrhosis. Then we have venous obstruction or compression. So the vein can be compressed by a tumor, or it can be obstructed by a clot or thrombus. And then an external pressure as well can lead to increased hydrostatic pressure. So if that pressure, external pressure of a mass, compresses on the veins, that can lead to impaired venous return. Then we also have lower extremity inactivity with prolonged dependence. Okay, but now let's understand how congestive heart failure can lead to edema. So heart failure can lead to edema. How? That is, in a heart failure patient, we have increased hydrostatic pressure. So the heart is failing to pump blood forward. So there will be accumulation of blood in the veins. So that accumulation of blood in the veins will lead to increased capillary pressure. Okay, so we have, so let's say this is the heart. Then from there, we have the veins this side. Okay, so if this heart here is failing to pump blood, what will happen is that the blood will backflow. Okay, there will be increased pressure, hydrostatic pressure here. So that hydrostatic pressure which is increasing here will lead to leaking of fluids into the interstitium here. Okay, so that increase in hydrostatic pressure will lead to what we call increased capillary hydrostatic pressure, and that increased hydrostatic pressure will lead to edema. Apart from that, heart failure can cause reduced renal blood flow. Okay, so the blood which is supplied to the kidneys will be reduced. Okay, so if the blood which is supplied to the kidney is reduced, the kidney will activate the renin-angiotensin-aldosterone system. So this system is a compensatory system which tries to increase the blood volume so that in response to this reduced renal blood flow. Okay, so the kidney will activate the renin-angiotensin system. Then that activation leads to release of this aldosterone. The aldosterone will lead to retention of sodium and water. So this water, which is retained by the kidney, will now increase the blood volume. So the blood volume, if it increased, the hydrostatic pressure is increased, then the fluid will leak out of the blood vessels, causing edema. Okay, that's one way heart failure can do that. And then renal failure as well can also lead to increased blood volume via the retention of sodium and water, and then edema will kick in. But apart from heart failure, other causes might be malnutrition, where we have low intake of proteins. So the choroid or the plasma proteins will be reduced. Okay, that is in malnutrition. And then in hepatic synthesis, okay, and nephrotic syndrome, where we have loss of proteins in urine, proteinuria, that is in nephrotic syndrome, we will have plasma reduction in plasma albumin. So that reduction will lead to reduced plasma osmotic pressure. And we know osmotic pressure is the one which keeps the fluids in the blood vessels. So if it is reduced, then the fluids will be lost. It will go in the interstitium, and then they will lead to edema. Okay. So now, what are other causes of edema? So other causes we mentioned to say we have arteriolar dilation. So arteriolar dilation, so arteries can be dilated by a neurohumoral dysregulation and heat. So heat, like in the skin, when it is hot, you see the arterioles dilate in order to lose heat. So when they dilate, they can increase the hydrostatic pressure due to accumulation of blood in those dilated arteries, okay, thereby leading to increased hydrostatic pressure that can also cause edema. Okay, then other causes we have reduced plasma osmotic pressure. Okay, that is in the case of proteinuria. As we have seen in that diagram, we saw that anything that will reduce plasma osmotic pressure will lead to edema. Okay, so apart from malnutrition, like low intake of proteins, we can have what we call protein-losing glomerulopathy, such as nephrotic syndrome, where we have loss of proteins in urine. So the oncotic pressure will be reduced, thereby leading to losing of water or fluids into the interstitium, causing edema. Then liver cirrhosis, the synthesis of albumin here is impaired. Okay, you know the liver is the one which produces the proteins which are in the blood. 70% is albumin. Then if the liver has a disorder such as in liver cirrhosis, those proteins are not produced, leading to accumulation of fluids. And then protein-losing gastroenteropathies as well can lead to edema. So here we are losing proteins due to a problem in the alimentary canal, or let's say in the gut. And then, apart from these causes, that is increased hydrostatic pressure and reduced plasma oncotic pressure, we have lymphatic obstruction. Okay, in that diagram, we saw that, in this diagram here, we saw that the lymphatic system drains the excess fluid back to the blood circulation. So if we have obstruction in this system here, what will happen is that we are going to have edema in the affected site. So what can obstruct the lymphatic system can be inflammation, so inflammatory disorders such as filariasis, which causes elephantiasis, mostly in the lower limb. It obstructs the lymph vessels, okay, leading to accumulation of the fluids in the limb and leading to a condition called elephantiasis. Then neoplastic, that is, we have a tumor compressing on the tumor of the lymphatic system, okay, that is in breast cancer or in any other tumors which affects the lymph, can lead to edema, accumulation of fluid in the affected area. Then post-surgical and post-irradiation. So that is post-surgical in, for example, in breast resection. Not even breast, but resection of the axillary lymph nodes. So during that surgery, the lymph nodes or the lymphatic vessels are obstructed. Okay, so when they are obstructed, we are going to have what we edema in the arm. Then apart from this, we have sodium retention, as we have seen in renin-angiotensin-aldosterone system. If we have sodium retention, that can also cause increased blood volume, which will lead to increased hydrostatic pressure, causing edema. Okay, but apart from that, we have excessive salt intake that is observed in renal insufficiency. So if the renal insufficiency, there is, if you take excess salt, then that will lead to edema, because salt always, where there is salt, water will always follow. So there will be accumulation of water due to this salt retention. Then increased tubular absorption of sodium can also lead to edema via the sodium retention system. Then inflammation as well can also cause edema. So in inflammation we have vascular permeability. So the endothelium will create some spaces where water will leak and also proteins will leak. So in inflammation, there is accumulation of fluid. Okay, that fluid will be an exudate. Okay, so thank you so much for watching. Don't forget to like and subscribe. In the next video, we're going to look at hemorrhage.